Hi and welcome again. After demonstrating basic PM-TOM features in the first video, we will show how to optimize polypharmacy treatments with PM-TOM. Again, we will use the real example of an 80-year-old woman admitted to a deprescribing facility. First, we will enter the patient's treatment at discharge, prepared in the illustrative example section. Then, we will optimize that treatment further by considering alternative medications for each disease. Enter patient record ID, patient A, then set version to 1. Version 0 was assigned to the admission record in the previous video. In notes, enter discharge. Click the button Discharge in the section. Enter an illustrative example to populate the discharge treatment, along with the patient's suspected adverse drug reactions. Review the data and click the button Submit. Review the statistics on treatment medications. This discharge treatment improved the patient's condition, mostly due to the pain management drugs. However, the number of adverse drug reactions and interactions did not significantly change, raising concerns about whether this treatment would be stable in the long run. We will address that concern in the next step. Go back to the previous screen. Set the record ID to Patient A, version 2, and notes to optimize. In the Enter an Illustrative Example section, press Alternatives. Review populated data. Note that option, All, considers all drugs from the classes used in the corresponding discharge treatment. Another approach is to select several specific alternative medications from the same or different classes under the same disease and treatment part. Submit the alternative options for optimization. Review the report. The section Patients, Diseases, and Considered Drugs reiterates the options selected in the previous window, while the section Optimal or Existing Treatment lists selected drugs from indicated alternatives. For example, for chronic heart failure, pitavastatin was selected from the statins class, zofenepril from the ACEI class, etc. Next, review the adverse drug reactions and interaction statistics. The count of positions marked in red is significantly lower than in the admission and discharge treatments, which will be further quantified in the next steps. Select the PM-TOM function. Compare treatment versions and enter Patient A. The report summarizes the counts of adverse drug reactions and interactions for each treatment version. The optimized treatment shows significantly fewer adverse drug reactions and interactions. The next table provides further details. Select function Prepare Deprescribing Plan. Enter the patient ID and the initial and target treatment version. For example, 1, discharge, and 2, optimized, and then submit. The report shows the statistical information about the initial and target treatments and the questions prepared for ChatGPT. Review it and adjust, if necessary. Request the plan. The deprescribing plan suggests how to taper medications to be discontinued and introduce their replacements. For example, stop acetylsalicylic acid immediately if there is no history of coronary artery disease. Replace atorvastatin with pitavastatin with no specific tapering. Replace bisoprolol with celiprolol over 1 week and ramipril with zolinuril over 2 weeks. Review other suggestions. Thanks for watching. Use the PM-TOM application to analyze and optimize other treatments. Review the publications and other information about PM-TOM at the site pmtom.com.